Come in. Good morning, Jamie.
Hi, Miss Jones.
Thanks for asking me to talk about acute respiratory distress syndrome, or ARDS. As a nursing instructor, I appreciate when students take the time to clarify subjects that they are struggling with in class. First, can you tell me what ARDS is?
ARDS is respiratory distress in a patient with any of the following characteristics: hypoxemia that persists with 100% oxygen therapy, decreased pulmonary compliance, dyspnea, non-cardiac associated bilateral edema, or dense pulmonary infiltrates noted on X-ray.
Great, Jamie. If you were caring for a patient with ARDS, what team members might you collaborate with?
I think that I would involve physicians, nursing staff, respiratory therapy, lab, radiology, and possibly nutrition and social work.
Good job. What lab tests are we most interested in with this patient, and what are the normal values?
An arterial blood gas would be very beneficial. Normal values for adults are pH 7.35 to 7.45, PCO2 35 to 45, PO2 80 to 95, and bicarb 22 to 26.
That's right. What nursing assessment would you perform first on this patient?
I would assess breathing, both rate and pattern, determine work of breathing, any noise with respiration, and if they have any cyanosis or retractions. Patients with ARDS can change very quickly, so I will want to reassess my patient often.
You would also want to be alert for changes in mental status, as this is one of the first signs of hypoxia. On an X-ray, what does dense pulmonary infiltrates look like?
They are described as a haziness, a whiteout, or ground glass appearance.
Those are great descriptions. Jamie, what are some interventions that would be implemented for an ARDS patient?
They could include CPAP, or possibly intubation, medications such as corticosteroids, antibiotics, sedatives, and IV fluids.
Research has shown that patients with ARDS who receive conservative fluid therapy have better outcomes than those who receive more liberal fluid therapy. Why might this be?
I think patients with ARDS are probably very sensitive to fluid overload.
That is right. If this is happening, what order might you expect the doctor to give?
Some type of diuretic, like Lasix.
Yes. Let's further discuss nursing interventions for the ARDS patient.
Airway maintenance, including suctioning as needed, positioning with the head of bed greater than 30 degrees, repositioning at least every 2 hours, frequent monitoring of vital signs, continuous oxygen saturation monitoring, and prevention of any infection.
What infection prevention techniques would you use?
Hand washing, good oral cares, use proper suctioning technique, and wearing appropriate personal protective equipment.
You mentioned earlier that you might include nutrition in your collaborative care. Why is this?
A patient in acute respiratory distress is at risk for malnutrition due to the increased work of breathing. I would assess the patient's weight daily, monitor all intake and output, give feedings and nutritional supplements as ordered. I would work closely with a dietitian in managing this patient's needs.
Excellent, Jamie. I think that you are gaining a good understanding of ARDS and the nursing care involved. You are aware that it is very important to work with other specialty areas to care for these patients. The nurse is the center of the collaborative team. Thank you for coming to visit with me today. And let me know if you have any additional questions before the test on Monday.
I will. Thank you and have a great afternoon.
You too.